Hi everybody, it's Siobhan. Welcome to Information Technology Week. I'd like to introduce you to my little cartoon character here on the screen in front of you. Unfortunately, they did not have full-length dresses, which most of you know is what I wear usually. However, this was about as close as I could get. I had some fun playing with some technology this week, preparing your PowerPoints, and I hope you enjoy. So, information technology, this is week 6 for some of us, week 5 for others. And it's an online course, and the objectives that we're looking at are discussing the concept of nursing informatics, identifying and discussing the Canadian Association of Schools of Nursing, or CASN for short, entry into practice competencies of ICT, discussing the use of the internet to access health information by various Canadian population groups, and identifying types of ICT used by nurses, including the internet, mobile phones, social media, examples of Facebook, Twitter, electronic health records, electronic patient records, and electronic medical records. The next objectives are to discuss the use of technology to support health promotion, disease prevention, and chronic disease management, and differentiating between a targeted and a tailored online health information, online health intervention, using the Abbass-Dick et al. 2017 article discussing how the health information and messages created for the breastfeeding ehealth resource targets Indigenous families and supports health. So throughout these PowerPoints, we're going to address all of these different objectives. Nursing informatics is defined as a science and practice which integrates nursing, its information and knowledge, and their management with information and communication technologies to promote the health of people, families, and communities worldwide. To put that into very simple terms, it's using the science and practice of nursing, so all of that information that you have, coupled with information and technology and communication technologies that help us to reach out to our clients, their families, communities all over the globe. Nursing informatics is also a term, a very broad term, that's used to describe information and computer technology that supports all aspects of nursing practice. So this would include things such as direct care delivery. An example of that could be when nurses, community health nurses, are using an iPad to do their documentation at the bedside of a patient or couch side of a patient when they're visiting with them in their homes. It also talks to the administration for patients, research, and, of course, education. So even just looking at what I'm doing right now, I am using an ICT to meet your educational needs. I am using a computer to generate information for you. I'm putting it on a communication technology such as PowerPoint, and I'm giving you verbal feedback of that information via this recording. So all of those things are nursing informatics. They all fit within that box of nursing informatics. We do have a couple of definitions that are important. Public health informatics, that's defined as the systematic application of information and computer sciences and technology to public health practice, research, and learning. CASN's overreaching competency for ICT is that nurses use information and communication technologies to support information synthesis in accordance with professional and regulatory standards in the delivery of patient-client care. There is a link to the document right here. So if you click this link, it's going to take you to the PDF copy of the Entry to Practice Competencies. The front page looks like this. The first competency is information and knowledge management. This is where nurses use relevant information and knowledge to support the delivery of evidence-informed patient care. Some of the indicators of using this competency are that you're able to perform search and critical appraisal of online literature and resources. Scholarly articles are an example of that, looking at websites that help to support your clinical judgment and evidence-informed decision-making. That you can analyze, interpret, and document pertinent nursing data, patient data, using a standardized nursing and or other clinical terminologies to support your clinical decision-making and nursing practice improvements. That you're assisting patients and their families to access, review, and evaluate information that they're retrieving using ICTs. So is it current? Is it credible? Is it relevant? Using the ICT to manage their health. So for instance, social media sites, smartphone applications, so apps, online support groups like Yahoo. Just that you're able to describe the process of data gathering, recording, and retrieval in hybrid or homogeneous health records, so electronic or paper, or if you work somewhere that has a hybrid where you do some of your documentation online and some of your documentation is in paper format. That you can identify informational risks, gaps, and inconsistencies across the healthcare system. That you can articulate the significance of information standards, such as standardizing clinical terminologies. The significance of those information standards are really necessary for interpretation of electronic health records across our health system. That you're able to articulate the importance of standardized nursing data to reflect your nursing practice, to advance nursing knowledge, and to contribute to the value and understanding of nursing. And lastly, that you're critically able to evaluate data and information from a variety of sources, including, experts, clinical applications, databases, practice guidelines, relevant websites to inform your delivery of nursing care. This isn't so different from your understanding already of how to do data gathering for research. The second competency is professional and regulatory accountability, that the nurse is using ICTs in accordance with professional and regulatory standards and workplace policies. Some indicators that are built into this are that you comply with legal and regulatory requirements, ethical standards, organizational policies and procedures, for instance, policy and procedures including and laws for the protection of health information, privacy and security, so accessing only the health information for a patient or client that you are involved in the care of, maintaining that circle of care, privacy. That you advocate for the use of current and innovative information and communication technologies that support the delivery of safe and quality care. That you identify and report system processes and functional issues such as error messages, misdirections. For instance, if you click on a link and it goes to the wrong website or it goes to the wrong document, you're going to want to make sure that you identify and report that. This would also include reporting any device malfunctions. So if you have a glucometer that's not functioning properly, or a computer or a printer or a fax machine, anything like that, you're going to want to make sure that you're reporting that appropriately based on the policy and procedure at that workplace. That you're maintaining effective nursing practice and patient safety during any period of system unavailability by following organizational downtime and recovery policy and procedures. This includes making sure that you know your patient so that you have an understanding of what information it is that you're going to need to gather and document during downtime. Demonstrating that you have professional judgment and that prevails in the presence of technologies designed to support clinical assessments, interventions, and evaluation. This includes monitoring devices. A really good example of this is blood pressure. You're using an electronic blood pressure device, and it takes a blood pressure and it tells you that your patient's blood pressure is 60 on 40. And when you look at your patient, the patient is sitting up in a chair, talking, laughing, their skin color is good, their eyes are bright, they're alert, they're oriented. Chances are pretty good, using your clinical and professional judgment, that the technology is wrong, that the blood pressure is not actually 60 on 40, and that you're going to use your professional judgment to retake the blood pressure using a manual blood pressure to see if the electronic blood pressure monitor is not accurate, and then that would need to be reported so that nobody else uses it. That you're recognizing the importance of your involvement in the design, selection, implementation, and evaluation of applications and systems in healthcare. When your workplace is going to be transitioning from one electronic documentation system to another, and they offer you the opportunity to try it, to provide feedback, that you recognize the importance of your involvement in that, because you're the one that's going to be using it. So you need to make sure that if you have any concerns, that they are voiced. And competency number 3, information and communication technologies. Using information and communication technologies in the delivery of patient or client care. So indicators for that are that you can identify and demonstrate appropriate use of a variety of information and communication technologies, such as point of care systems, EHR, EMR, blood glucose monitors, tele-home care, or fetal heart monitoring devices. All of those are used to deliver safe nursing care in many different diverse populations and in a variety of settings. Another one would be that you use decision support tools such as reminders or critical pathways or web-based clinical practice guidelines that assist you with clinical judgment and safe patient care. That you use ICTs in a manner that supports, so does not interfere with, the nurse and patient relationship. A good example of this is the telehealth relationship with a patient. Even if you're on the other side of a webcam, you still have a requirement to establish a therapeutic relationship. You can't allow the technology to interfere with that relationship development. Describes the various components of health information systems. This would include things like computerized provider order entry, electronic medication administration records, things like that. That you can describe the various types of electronic records used across the continuum of care, such as EHR, EMR, and what their clinical and administrative uses are. And that you can describe the benefits of informatics to improve health systems and the quality of interprofessional patient care. How do we know that you've met these competencies, or more importantly, how do you know that you've met these competencies? Using all of those ICTs that you currently have at your disposal, like the computer that you're watching this video on or the phone that you're watching this video on, open the Kaizen document, scroll through the competencies, do a little bit of reflection. Where are you with the indicators? I'm sure you're much farther through those indicators than maybe you think you are. It's important that you know where you sit within those. If you're somebody who's not technologically minded, it's not something you enjoy exploring, then maybe you're someone who wants to reach out and get some extra support so that you can have more tools in your toolbox in order to do well with the upcoming ICTs that you're going to be working with. It is one thing to see the indicators in terms of what is it. that we're expecting of you, but it's another thing entirely to understand them. And so to understand them, you have to do that reflective process and relate them to your own experiences. So this is where you get to do some fun things. You're going to log into Socrative at socrative.com, and you're going to click on the student login button, and then you're going to enter our room name, which is Bell, B as in boy, ELL 1126, and then click join. And you're going to work through some activities to help you understand how the competencies are related to you. Access to health information. This is really just your reminder about privacy and the circle of care, so that patient information is only shared by those that are deemed as necessary to the care of the patient. I know that you've covered this in a great deal of other classes. As it relates to information technology, you need to think about electronic locks. We have systems that are built into our electronic health records, for instance, that require you to identify your patient on multiple times while accessing their record, so that we can decrease the amount of times where you may have clicked on a patient that has a similar name and opened their health record instead of your patient's health record. So it may ask you to verify, is this really the patient that you want to see? Another example of electronic locks would be if you're using an iPad in somebody's home to document your assessment and treatment, that there would be a lock on the iPad or tablet. Usually it's numeric, and you have to enter that prior to getting access to open the electronic health record. So that information is actually what they consider double locked. And then looking at places that are using fingerprint identification, where you need to fingerprint identify yourself to access or open a computer in order to access electronic records. There are a lot of different modalities out there right now in terms of trying to increase our security of private health information on technology. So technology related to health promotion, disease prevention, and chronic disease management. There are so many technologies out there right now that is there to help clients, to help nurses, help clients with their health, to prevent disease, and to manage those clients that do have chronic diseases. One of those is an ICT that is currently being used at sick kids to assess pain. It is a fantastic application called Pain Squad. It is a really great watch, so I'm going to just leave it here. You can click on the link here to play it within the PowerPoint, or you can copy and paste the YouTube link into the web browser in order to open it up. Again, that's called Pain Squad, and it's being used at sick kids. It's fantastic, so I hope you take some time to watch it. The next one is a mobile app called Fujicate. It's a nutrition tracker. I've linked the website down here if you'd like to go and read a little bit more about it. Otherwise, you can log into your App Store or into your Android App Store and have a look for Fujicate. It has really great ratings from people who have been using it, and it is for personalized nutrition. The next one is Sleep Cycle. Sleepcycle.com is the website, but if you go to your App Store, you can just search for Sleep Cycle alarm clock. So this is an alarm clock that actually helps to track how much sleep you're getting. I don't know about you, but I'm not sure I want to know the results of that. And Humber Bachelor of Nursing's very own Barbara Chizzy's ICT, sorry. I've left the link here, so if you click on this, it's going to take you to a website where they have featured our very own Barbara about mobile phone-based peer support for adolescent mothers. This is also a really great read. I hope you take some time to look through it um, and see how much is being done to help. So, nursing informatics, again, defined broadly in terms of the use of information and computer technology to support all aspects of nursing practice. This includes direct delivery of care, the administration of patients' records and care, research, and of course, education. So looking at the three different types of records, we have EHR, which is electronic health record, we have EPR, electronic patient record, and we have EMR, electronic medical record. So I'm just going to briefly go through the differences between the three. So the EMR usually focuses on patient data for a specific area or specialty. Records can be made for, let's say, a department within a hospital or a group of patients within a department at one site. The records usually stay within that group, and they can be shared between different sites of the same institution, but not usually between hospitals. So this would be an in-hospital record of each patient. So it's specific to that hospital. So let's say if I went to visit Brampton Civic Hospital, my electronic medical record would only include visits at Brampton Civic Hospital and could only be accessed at Brampton Civic Hospital or one of their sites, so within the William Osler Health System. So that would be at the Etobicoke site, the Brampton site, or one of their outpatient clinics. And the second one is EPR. EPR is electronic patient record. It's a term that's mostly used in the UK, the United Kingdom. It's essentially this. It's very similar to electronic medical record. However, EPR is an electronic record of periodic health care of a single patient provided by one institution. So it's a very patient-centric way to build an electronic medical health record. Medical record. So EPR is that individual's record that is within the EMR, the electronic medical record. So that would be Siobhan's record at Brampton Civic Hospital within William Osler. The electronic health record, on the other hand, is designed to be a complete electronic record of a patient from birth until death. So different care settings and institutions would combine all of their aggregated data to one single record. This, I guess, would be more described as a repository of information of all of your healthcare in a computer readable format. This is something that we're still working towards in Canada, where you could have an electronic health record that is fed data from anywhere that you access care. And then some examples. The first one that I'm showing you is Meditech. So there's two different screens here. Both of them are Meditech. However, one of them has what they call a skin on it. So Meditech, and I've linked their homepage here. Meditech is a company that designs electronic health record databases for institutions, organizations, but they can choose which kind of skin to put over the framework of the original Meditech product in order to make it visually appealing to what that organization wants it to look like. So it can be customized depending on what the institution has a priority for. And the second one I'm going to show you is Cerner. It's a little bit of an older company. I know they're still using it all over the place, but the reason I wanted to show you is because they've actually started to work with a company on population health management tools. So Cerner announced a partnership in 2016 with Wirral Partners. They integrated primary and acute care systems in the UK with something called Cerner's Health Intent, which is a population health management platform, and it focuses on establishing new models of care for disease management and prevention. I've also linked here the website for that as well. It's a really interesting twist on documentation or electronic health records. Some other resources for you. The Governor General of Canada did an audit on our implementation of electronic health record Canada-wide in 2010, and that link is here. In that link, they talk about the importance of having a personalized electronic health record that follows you from birth to death and that is fed data from every interaction within our healthcare system that you have. So it's a way for practitioners to really get a overall large picture view, as well as looking at the details of your health history, basically. And the second one here is the Canada Health Infoway. I have linked their website here. So the Canada Health Infoway's purpose is to realize the vision of healthier Canadians through innovative digital health solutions. They're an independent, not-for-profit organization that's funded by the federal government, and they were established in 2001. They're really a driving force for delivering better quality and access to care more efficiently through the delivery of health services to patients and clinicians using ICT resources. And now we're going to look at ICT used by nurses. So this is a bunch of different pictures that I've put on here. One is of these are mobile device ICTs, so fax and scan. Tiny Fax is a app that you can use to send faxes from your phone, so you could take a picture and fax it. Tiny Scanner is an app that you can do single or multiple page scanning using the camera of your phone and then email it, or you can store it on a cloud drive such as Google Drive or OneDrive or something along that line, or Dropbox. And then underneath that is Zoom, which is a video conferencing software that is an app on your phone, so you can FaceTime, which is an iPhone Apple term, but Zoom would be available to all devices, so Android, laptops, desktop computers, Apple cell phones, Android cell phones, all of them could use an app called Zoom, and you can web conference face-to-face with people, patients. Kind of like Skype, except that Zoom is password protected, where you set up a room so you could have multiple clinicians in a call with a patient, or it could just be a patient and you, but nobody can access that call without the code. And then this one, kind of funny, Post-it notes. There is an app that if you were working with a client and you had a lot of little notes about what they would like to see, or if you're working with a community and you do some timelining, you can use this app made by Post-it that will take a picture of all of your Post-it notes and create a PDF document that you can then email or save to yourself. Some other apps are, this one's a ABG, so arterial blood gas analyzer. You can plug in ABG results and get a really quick sense of what you're dealing with. And the one beside it is a bones and muscle 3D anatomy book that you can pick which area of the anatomy you want to see and then rotate the joint or the bone or whatever to see all of the bones and ligaments and muscles that are attached. So it was very handy for studying, but also working with patients who have chronic diseases of the joints. It lets you just have a really good visualization of what muscles are going to be affected. And then books. You can download all sorts of books, textbooks, picture collections of wounds. You can download them into a e-reader format. You can download them from Apple Store, so using iBooks. Or you can look at Chapters Indigo in Canada. So there's lots of different options for that. Then there's some other ones. So the Nursing Drug Handbook is, you would purchase this book usually. However, they do have an app that contains everything that's in the book. Obviously, that's not able to be used in a lot of clinical settings because you're not allowed to have your phone with you. But in practice, this is quite handy to have, especially if you're traveling around to patients. This lets you do some research on the medications that your patient may be taking. Another drug guide is the Davis Drug Guide for Nurses, so both of them are great apps. The Drug Interaction Checker, there's a couple of different versions of that are out there. Most of them are available on the intranet of the place that you work as well, where you can plug in all of the drugs that and like over the counter, as well as herbal remedies, natural products that people are taking. You can plug all of them in together and it will check for interactions between each of those drugs. And then Nurse One. Nurse One is a Canadian Nurses Association website that was created specifically for nurses to be able to have an online resource to go to for ongoing education, talking about what's coming up, both in education and in future research and technology. There is a lot of information there for you. I've included the link here if you'd like to explore that. Some more nursing online resources. INF Fusion, so that's also part of Nurse One, developed by the CNA. There's also the Canadian Best Practices Portal for health promotion and chronic disease prevention. And then moving on to just a reminder of what the difference is between internet and intranet. Really looking at when the nurse is using internet, that this is a very public network, that the information is unlimited. However, it does not necessarily mean that the information is always accurate or valid. The intranet, however, is private. It's a private network. There's less users using it. It's usually considered a very safe network because it's only accessible by people within that organization. But it does have limited amounts of information that circulate among that organization. But we don't have to worry then about credibility and reliability because that is vetted through the library of the hospital. So this is from Stamler, just looking again at your use of internet and intranet, utilizing ICT to generate, manage, process relevant data to support your nursing practice. That internet has really become a key source of information because it's something that we can almost always have access to, and that we can communicate with people globally. We just have to, again, keep in mind that we're always assessing the credibility of the information that we are retrieving. So with regards to that, looking at the integrity of the information, we're looking for a number of things, but there's so much information on the internet, and it is very highly variable. Both the nurse and the public are going to be challenged to determine if what they're reading is quality information and if it's credible. There's very, very many different dimensions. So there's journalistic valued information. There's stuff that's for a target audience. We're looking at lots of blogs, research. There's Quora, which is an online question and answer. So many of those different modalities on the internet have a vast amount of information, but they're not necessarily credible information. So when we're looking at that, we also need to keep a couple of things in mind. The journalistic value. Why did they write it? The targeted audience. Who is it for? The website design. Are we able to see where the information is? Is it simple to find what I'm looking for? The readability and the usability. Is it in language that's appropriate for the reader? And ethical issues of privacy. Are they following the both legal and ethical implications for putting information out that's available to the whole world? One of the things that we can do is use the Health on the Net Foundation's code to examine online information. You can do this with your client. It's a really good way of teaching them the criteria while simultaneously critiquing the information. So the 8 principles are authority, complementarity, privacy, attribution, justifiability, transparency, financial disclosure, honesty in advertising, and editorial policy. In your textbook, Table 15.3 has 10 questions that clients can use when they're assessing internet health information. The first one is that information provided by a qualified medical practitioner or an organization that's committed to the public's health? The second one is, does the website encourage you to discuss the health information with your physician or other healthcare professional? Is your identity protected while you're on this website? Does it indicate the source or reference for the information that's provided? And are those sources credible? Are claims of effectiveness of treatment supported by credible evidence? Is the authorship of the website clear to you? Can you contact the webmaster for more information? Is the sponsorship of the website clearly apparent to you? So for instance, if something says, drink 10 liters of orange juice every day and you will never have a cold, and the website is sponsored by Dole, then that's going to raise some credibility issues. Is there a link on the homepage of the sponsoring organization from the health information webpage? And does the homepage explain the mission, the purpose, the objectives, the sources of funding, and who's governing this organization? All great questions. So the difference between targeted or tailored online interventions. A targeted online intervention is aimed to reach a high-risk population. So it's really based on their preferences and the needs of that population. So the intervention is designed specifically for them. A tailored online intervention has interactive features that allow you to then create individualized or personalized responses. So this is just some more information talking to you about how you can use ICTs to support health promotion through interventions that are accessible via, let's say, the internet. Looking at delivery cost, can we get that information to them? And their willingness to actively manage their health. Do they want to be the keeper of their health information? Online interventions can be very effective and have been shown in a variety of areas to have significant positive impact on at least one intermediate health outcome. And social media can afford patients an opportunity to gain access to health information or to explore care options and to share health experiences. Quite often when somebody's on social media looking up health information, what they're really looking for is someone to share their story with. Computer programs that include interactive components such as calculators that estimate the cost of smoking have been shown to be more effective than just talking to them about smoking cessation. And telehealth technologies are very important today as well because they provide accessibility to healthcare services that somebody may not be able to access otherwise. For instance, being able to speak to a specialist when you live in a small community. And lastly, the Abbass-Dick et al. 2017 article overview. This article was aiming to create a culturally relevant online breastfeeding co-parenting resource for Indigenous families. There are a number of PowerPoint slides after this that go through all of the different pieces of that article. It is very important that you read that article. It has a lot of great insight. And then there's some questions for you to work through in regards to that article. I hope that I've explained things as well as possible and that you have gotten lots out of this. You're welcome to answer or ask any questions. I'm happy to answer. Thank you. Have a great day.